Okay, so my name's Gary Kasulu, and I'm very excited to be interviewing Dr. Al LaMotte. He has a very specialist subject in optics. I've been in optics a long time, but he doubles me. Al, do you want to tell us who you are? What is your passion, sir? How long have you been studying optometry?
Hi there, I'm Dr. Albert LaMotte, and I've been optometrist licensed for 40 years. I originally came from Minnesota, went to Ohio State University College of Optometry, graduated in 1982. I know that's a long time ago, and that's a good thing because I've had a lot of clinical experience in various settings. My passion ends up to be probably the thing that most of you, if you're optometrists, didn't really care for when you were in school. And to be honest with you, I didn't either. In other words, binocular vision anomalies. And of course, that was a very interesting area that we all studied. And a lot of us went on with that, and a lot of us didn't. I really didn't want to go on with it until the demand for it became so great that I had to kind of say, you know what, to be ethical, I have to move forward. And really had to go back to my notes. I had to go back to my thinking as an optometrist and learn because you know what? It is one of those things you have to learn after school. There's no way you can learn all of this with the 200 plus patients that you do because this does not apply to a good, well, probably 60% of the patients or more. It does apply, however, to all children. Now, I don't know about you people, but 40 years ago, there was not an emphasis upon pediatrics like there really should have been. And I can't change the past. But what we all can do is change the future. And that's why I'm here. I'm a regular clinician like most of you. And to be honest with you, I'm a little bit guilty. I'll tell you why.
Why?
Because I probably did not put the passion into the children because I did not have the skills to get that passionate about it. And I wasn't aware of the problem at the level that I am now. And so at this point in my life, I now feel I have to give back somehow. And I have to give to the community of optometry, but moreover, the community that I serve and also the whole world, actually. As we all know, we all have eyeballs and we all deserve good eye care. We all know that. But we are having a hard time getting from here to there. Does that make sense, Gary?
It totally makes sense. When I know in the UK that optometrists fail on binocular vision more than they fail on any other exam when they're training. And you said so, you've done something quite remarkable. You looked at my head tilt and you said, you know what, you got one base prism up. And I said, no way. I've had 1,000 eye tests in my day. I'm going to go for an eye exam and I'm going to see what happens. And you were right. You diagnosed one prism base up just because of my head tilt. And I told other optometrists since then, and they say, I need to know more. I want to understand more. So I think you're a remarkable human being. Your grassroots at its truest. And if you are just about to start out as an optometrist, or whether you've been doing things for years and it's not really been your field and you don't like prescribing prism, you know who you are. Please join us. We'll be doing updates every Friday. Where Coleman, Charlene, when are we doing the big event in Feb?
I think we settled it for the third week in February. We're going to lock in a date and time today. I think we agreed, Dr. LaMotte, it would be the third Thursday in February. Thursday seems to be a really good day for eye care professionals.
Right.
You do not want to miss that day, but we're going to drip feed lots of really interesting content.
Right. Yeah.
We're going to drip feed lots of interesting content in the meantime. Come and join us in our group. If you're already in the group, welcome. Al will take questions on Mondays. We're going to try and like ask those questions and we'll get them answered on a Monday. But I certainly, this is one of the most rewarding things I've ever done in terms of marketing for optics. This is so amazing. And Al, I really recognize in you for driving this forward, that you want to test children's sight before 3, you want to communicate with pediatricians. So if you're a pediatrician out there and you want to learn more about young sight, come on in. The door is open for you. Al, have you got any last minute comments before we wrap up this quick interview today? We're going to be going live next week to get your questions answered.
Well, I wanted to just say that how I've talked to my patients is this, and I've come up with this analogy. I try to get to their level. Here's the analogy I come up with. We all learn speech by the time we're 3, correct? We all do, unless you have a hearing impairment. Now, that's the deal. If we have a vision impairment, like binocular vision, we do not learn vision the way we all think we all have it. Therefore, we need to have assurance that the children are getting that binocularity before the age of 3. Doesn't it make sense? It's an analogous thing to speech and to hearing. We are just another sense, but it's the most important sense. If you ask anyone, the number one thing they wouldn't want to be without is their vision. Yet the speech and the hearing have actually gotten first place. We need to get into first place, or at least equal or parity with the others. That's my final statement for right now. Thanks, Gary.
Wow, you're very powerful. So if you're prescribing out there and you're not sure about patching, you're not sure about monocular vision, you're not sure about any of these subjects, get your questions ready because we'll be answering them on a Monday. This is such a wonderful thing to be doing. We'll see you next week. I hope you've enjoyed this little update. Cut.
Thanks a lot, Gary.